Market an IOP or PHP in Maryland before you understand COMAR 10.63, and you are advertising a program your license may not support. Maryland keeps separate COMAR program standards for IOP Level 2.1 and PHP Level 2.5. A conversion is program operations, not a renamed group therapy block. If you already run a Maryland group practice, adding intensive outpatient or partial hospitalization services can look like a natural next step. This is a strategic orientation, not legal advice. The licensing, staffing, location, and payer questions to resolve before you start advertising IOP or PHP. Why does the conversion make sense for many Maryland practices? Maryland shows meaningful search demand for addiction treatment, including terms like Maryland drug rehab and Maryland outpatient addiction treatment. And you are not starting from zero. You may already have licensed clinicians, referral relationships, and a local reputation, plus patients who need more structure than weekly therapy provides. But the risk is specific to conversion. A group practice that becomes an IOP or PHP is moving from professional outpatient services into program operations, changing level of care, documentation, payer review, facility credentialing, and revenue cycle risk. Maryland should be treated as an accreditation and licensure planning state, not a casual IOP add-on state. Confirm the category before you design the offer, sign a lease expansion, or tell referral partners you are launching. Here is the strategic takeaway. The hard part is aligning licensing, accreditation, payer credentialing, documentation, staffing, space, admissions, and billing around one program. Behave Health brings the software layer together: EHR, CRM, RCM, admissions, documentation, authorizations, and reporting, designed to work as one operating system for treatment programs. And Behave Consulting helps behavioral health operators turn that complexity into an implementation roadmap. 4 questions to resolve before you market the program. Work through each one before you advertise an intensive outpatient or partial hospitalization program. Question 1. Your licensing category. Maryland's licensing analysis starts with the Behavioral Health Administration and COMAR 10.63. Review the BHA program page and its accreditation-based licensing guidance before assuming you can simply add an IOP track. COMAR has separate program standards for IOP Level 2.1 and PHP Level 2.5. And the application process makes the analysis dependent on your exact site, services, ownership, accreditation status, and population. Question 2. Staffing and clinical leadership. The staffing question is not simply whether you have enough therapists. A conversion needs clinical leadership, level of care governance, documentation discipline, and payer-facing review capacity. Ask, who is clinically accountable for the IOP or PHP level of care, and whether your team can support medical necessity documentation for a structured program. If you plan to involve the Joint Commission or CARF, treat them as implementation inputs, not a substitute for state-specific licensing advice. Question 3. Whether your current office can support the program. Sometimes the existing suite works. Sometimes it is too small, too exposed, too hard to schedule, or too disconnected from the operating model. Evaluate the entrance, longer program blocks, and whether the site aligns with the service level you plan to verify under COMAR 10.63. And check local approvals, landlord restrictions, accessibility, and life safety expectations against the proposed use. Question 4. Maryland Medicaid and commercial payer strategy. If you intend to accept Medicaid, begin with Maryland's official behavioral health coverage page and the SUD self-referral manual, then verify details with the state or the Administrative Services Organization. Maryland providers often evaluate CareFirst, Kaiser Permanente, and other regional plans. Each may treat IOP, PHP, mental health, and SUD services differently. Verify enrollment, credentialing, medical necessity criteria, and authorization review before relying on the revenue model. Put side by side, the shift is bigger than it looks. A therapy practice becomes a licensed treatment program, evaluated against COMAR program standards. And the business has to survive the operational change from group practice billing to program-level reimbursement. This article is a diagnostic starting point, not a launch manual. Verify the current Maryland requirements with the Behavioral Health Administration, with qualified counsel, with your payers, and with an implementation partner like Behave Consulting before you market the service or commit capital. Stop advertising a program your Maryland licensing and billing posture may not support yet. Scope the conversion with Behave Health. Book a 20-minute demo at behavehealth.com.